We lost you, Margie.
Recording. Right. Welcome, Carol Morocca, who's going to give us a presentation on the health issues in Chaffee County today. Carol.
Okay, good. Okay, there we go. So I'd like to introduce the concept of a healthcare committee for Chaffee County. Right now we have two people besides myself. Ann Graham is one, and Jody Boyle is the other one, and they were both out of town today. But they have met with me and my house about 3 times, and we've brainstormed and thought about some things that we can do to get ourselves educated and some of the concerns that we have individually for healthcare in Chaffee County. So I'm going to present to you pretty much what we've done, just to let you know. And if any of you are interested in joining our committee, I have a list of people that Karen has been kind enough to give me that indicated that they have interest in healthcare. And I'm going to contact those people because we'd like to get our committee a little bit larger. I want to just bring you up to date on what the League of Women Voter healthcare initiatives are. At the League of Women Voters, USA one, in June, there was a conference held in Denver. Susanna, you went, and we had a presentation at the picnic by the other gentleman who went. The healthcare concurrence that was put together by the New York State League of Women Voters was passed unanimously. There was some verbiage that's going to be changed, and it's going to be incorporated into the national document when it's updated and posted the next time. If you want to find out more information about this, all you have to do is Google the League of Women Voters New York State Healthcare Concurrence, and it will bring up the concurrence plus some other information. It looks like this. And basically what it says is that it has a goal of affordability, equity, and that the cost control and the financing administration are supported as a single payer plan by the League of Women Voters nationally. And that is certainly part of the interest of people who are in the Colorado Healthcare Committee. Most of the people there are working to promote a single payer plan. At the Colorado level, not everybody has healthcare committees. In fact, I don't think we even are at 50%. But the people in the chapters that do have healthcare committees, they have their own separate issues that they're bringing light to in their counties. So La Plata, which is Durango, has a hospital that they are very concerned about for high upcharging and so on and so forth, kind of similar to what we've identified as one of our issues in Chaffee County. Interestingly enough, they're both under the Centura umbrella. So that's what the League of Women Voters Colorado Healthcare is doing. And our last meeting was basically a video on single payer plan. So our committee has just gotten started. As I mentioned, Jody and Ann and I have met. Our main concerns are the impact of healthcare costs in Chaffee County. A lot of information about how many people do not have health insurance and so on and so forth is not available to us. And so we've been reaching out to the public health department here to try to get an idea of what the rate of uninsurance is in Chaffee County. And we're working on that. But our main emphasis has been on trying to contact the Heart of the Rockies Regional Medical Center about their transparency, compliance, and and if they're being compliant with the CMS regulations. And we have been totally stonewalled by them. They won't get back to me at all. So now that I've gotten my head up from a month of very serious landscaping and planting, I'm going to get started on actually going over to the heart of the Rockies and contacting their administration area, because they have not responded to any of our requests. So we've also done a lot of self-education. So that's what I want to kind of bring you guys up to very quickly, what we've self-educated ourselves on. We are participating in webinars with the state healthcare and policy department, which is Medicaid, but they do Medicaid, but they also do a lot of other things. So that's kind of what we've been doing. Any questions or comments about that?
I had a couple things in the chat, Carol.
Oh, okay. You want to go and tell me what they are?
Yeah. Can't HRMC billing tell you the number of uninsured?
No. Oh,
Can't or won't?
they can't, because that's considered proprietary information.
Not a number of accounts. 50, 100,000. That's not proprietary, I don't think.
Yeah, they have not been forthcoming with anything.
And have you contacted any of the board of directors?
Yes, you can't contract the board of directors directly. You have to go through the hospital. And they have not responded to any of my attempts to contact the board members. Our first—
About former board members. You should be able to contact them directly.
Yeah,
We
we
have a lot
could.
of big ones.
Yeah, we could. So if you have contacts for those people, we would love to have them. We
Okay.
have not. I mean, I know Lydia, but she's new. I want
Right.
somebody who's been on the board for a while. So trying to get somebody who would talk to us about their experience would be great, Karen. So just if you could email that to us, we'd be
I'll just
great.
send you their contact info.
Okay, great. Anything else?
Nope. Thank you.
All right. So there are some really, I think, fantastic healthcare initiatives that the Colorado government and the legislature have been trying to bring forward. Not a lot of people know that Lieutenant Governor Diane Primavera has started a office of saving people money on healthcare. And they are doing some pretty cool things. And one of the papers that they produced is called The Toxic Impact of High Healthcare Costs on Coloradans. So we've printed that out, reviewed it, discussed it, and it's one of our definitely concerns in Chaffee County, without a doubt. People, not only can't they afford housing, but they can't afford health insurance either. Some are on Medicaid, but there's always that people that fall in between the cracks, even with the Affordable Care Act. The other webinars that we've been attending are with the Colorado Department of Health Care Policy and Financing. They do a lot of Medicaid initiatives. And as you would understand, Medicaid is one of the big budget items for the state of Colorado, as it is for every state. And it's now, Medicaid has been expanded to cover people with pregnancies, even if they are not citizens of the United States. So that has just gone forth with the state of Colorado. It also has started some healthcare initiatives, and they are the ones that publish the Hospital Cost, Price, and Profit Review, which is a big, big issue in Colorado that very few people know about. But it's one of the things that the state Colorado Healthcare Initiative is really looking at. The other thing that got started with the same department is something called the Hospital Transformation Program. This has the potential of changing healthcare, hospital cost and billing dramatically. And they're doing it basically to try to save Medicaid dollars. So, Heart of the Rocky is a participant in this hospital transformation program. It's voluntary, but they are participating in it. And Margie, do you remember the thing that you sent me
Yes,
about the discount?
right.
That is one of those initiatives. Starting September the 1st, the hospitals have to be compliant with that. And that's why they were passing those out in Spanish and in English, which is the patient rights. And I'm going to go into that in a little bit.
Okay.
And then the hospital, the Colorado legislature has passed a bill that is really quite outstanding. And it's the hospital transparency laws. And I'm going to get into that in a little bit too. But this was signed into law by Governor Polis in 2022. And it's going to have a very large impact, I think, on the hospital transparency, especially in Chaffee County and in La Plata County, which is where we're kind of concerned about that. So here's what I want you guys to give me some feedback on. Do you think that healthcare activism, do you feel comfortable with the League of Women Voters doing that in Chaffee County? Or do you think we're overreaching?
Let's everybody unmute and everybody has any comments.
Do you think we can be effective as activists, or do you think we should put our stuff in some other place?
Well, does it meet our national healthcare policy goal? I assume that it does, but I don't have that right in front of me.
So Carol, you're looking at continuing to get more information of these items that you've talked about and to get more information from Heart of the Rockies and find out where they're standing with some of these different issues. That's what you're talking about, activism. Is that what you're saying?
Yeah, really engaging directly with the League of Women Voters, with trying to find information about compliance with the Heart of the Rockies Hospital. So I can tell you what I'm concerned about. I think that we are in a serious mess in Chaffee County in regard to healthcare delivery. I don't know if you guys know, but one of the outpatient medical practices just got hacked. Did you guys know that?
No?
What do you mean?
Their computer system. And so they have not been able to engage with their patients for almost 2 months. And the Heart of the Rockies, we actually wanted to figure out a way that we could survey people about their experiences with healthcare in Chaffee County. Allegedly, that's one of the things that the public health department did when they did the healthcare assessment and plan for 2022 to 2026. But that document that they have produced is pretty generic. It's not particularly specific about certain areas that they're concerned about. It's sort of global. So I don't want to, put a whole lot of time and effort in this if you guys think that we're overreaching about what we're doing. Basically, I think the League of Women Voters is about education and trying to get people involved in their health care and in things that impact our county, not just with people with voting or with the candidates. But, I don't want to overreach if that's what people think this might involve.
I think you're correct. I mean, the league has always, we've educated voters, have our forums. That's one of our hats, but the other one is to be active and involved. So let's go to your second point here. If yes, what should it be? Some possibilities. So I think that's maybe we could look at policy or statement papers. I'm looking down here to number 3 is certainly educating ourselves on healthcare. I would think that would be something that the membership would be interested in. Members, show of hands, shake your heads. What do you think? Would number 3 be something we'd be interested in?
Well, I think 3 and 4. And Carol, I believe healthcare affects everyone. And there are those lucky few that have always had their insurance coverage paid for by someone else. But a large majority of the population have had to pay large premiums and large copays. And I think that it's the messaging that we just have to be careful about. That's the only thing. I do not think it's overreach, so I would be in favor of us. And I think 3 and 4 are important for us.
Okay, I'm going to read you the US position. The League promotes a healthcare system for the US that provides access to a basic level of quality care for all US residents, including behavioral health, and controls healthcare costs.
So when we had our meetings, we felt that the Heart of the Rockies was not engaging in a quality way with the county residents in regard to particularly their charge masters. And that was having a very negative impact, because we all had quite a few stories about the negative impact of hospital charges on people that we knew. And we didn't, but you know, anecdotes don't make data in science, and certainly not in healthcare. So we wanted to really engage with the Heart of the Rockies and find out due diligence what they were doing, and give them credit if they weren't, and try to spur them to being more responsible if they, which they need to do. So that was one of the things that we felt was not overreaching, but I think, and I still don't think it is.
My thought is, and I agree with Wendy, 3 and 4 seem to be right now a priority to find out what's going on with policies and initiatives in our counties, you know, and educating ourselves more on healthcare. We've had these issues throughout the years, and you know, but we need to be brought up to date with it. And all of us seem to be in a certain age that healthcare for us is one thing, but for the working families, it might be something that we're not familiar with that much. You're talking about the people falling through the cracks. I think 3 and 4, and then after that, you know, then we can become involved with writing a policy or statement paper or lobbying, you know, the state or federal levels, whatever, and you know, that we're doing. But I think our first focus would be Chaffee County. Some years ago, Jeannie Younghouse was involved with this, Carol Brand-Kovacic. We studied, as a league, we studied the geothermal, the potential for having it as an energy alternative. And in the process of that, the league helped write a 1041, or did write the 1041 paper about that, which the county commissioners adopted. So we have studied issues and have taken positions on things before. But is there anybody that would be opposed to right now focusing on 3 and 4? Anybody opposed to that, 3 and 4?
Okay.
Can I make a
Eileen,
comment? This is
go ahead.
Julie. I was involved with the geothermal with Cheryl Kovacic. I do think studying the issue is fine. I think all the issues that Carol has mentioned needs to be studied and get some real facts that you can then deal with. And because you can't, and then I agree 3 and 4 probably should be the big factors of looking at the healthcare in the county, finding out, getting some real numbers and information for people that have insurance versus no insurance, so forth and so on. Doing that first, and then bringing that back to the league as a whole, and then we can make a decision as a league as to where to go from there. Rather than having activism at the beginning, I think you need to study the beginning and then re-look at it through the league after you've gotten your information. Thanks.
Thank you, Jeannie. Thank you for
I
that.
wanted to make one more comment. I'm sorry, was someone else in line?
I don't know. Anybody else? You can all unmute yourself if you want to talk.
I'd like to speak.
Eileen Rogers. Eileen.
I agree that we need to study this. I think it's our responsibility in society. I'm particularly concerned about the accounting department at the hospital, and I'm very concerned about the service community. 9 out of 10 of our service people are working part-time for several organizations. So they have no health insurance at all, and they can't afford it. And I think we need to talk about that and see if there's anything that we can do in the entire state, not just here in our county.
Thank you for that, Eileen. And we know that the state has this, and like Carol said, there's other leagues working on different aspects of it. I didn't know HRRMC is part of Centura. When did that happen?
I think about 5 years
Yeah,
ago.
quite a while ago.
Okay.
Yeah.
Um,
Okay, so I'm gonna zip through this PowerPoint presentation. But I want you to understand why we're focusing on why we're trying to get information about people's experiences with no healthcare insurance, what the barriers to care are, the inequity, and also the role the hospital plays in all of this, basically healthcare inequity. So does that make sense?
yes, and
Okay,
it looks like we have a consensus on the 3 and 4 topics, you know.
good. Okay, and that gives me a sense, oh shoot, what have I done? Okay, so I have a very close relationship with this woman, and she's someone that I have a great deal of respect for, and she's one of the most amazing woman who gives back to the community. So I want to tell you her story, because this is sort of the thing that kind of got me. You know, we talked about when we had our meetings with Jody and Ann, that a lot of data kind of goes over people's heads, but people's stories has a lot more impact. And Chaffee Cares is going to be doing some videotaping and some discussions in the future about healthcare access, cost, and so on and so forth, and the impact it has on people in Chaffee County. So that is something that we're working, we're just sort of partnering, not partnering, but we're getting information from Chaffee Cares. You guys all know about Chaffee Cares?
No.
Could you elaborate on that a little bit?
Chaffee Cares is working with the Public Health Department and the Chaffee County,
Community Foundation,
no, is it the one with gray?
Housing Department.
Housing
Department of
Housing Authority.
Yeah.
They're trying to get people housed and doing some brainstorming on affordable housing. And they did a presentation at the steam plant in regard to what it means to, and it was really very effective. And so now they're going to be doing it more on healthcare access and not being able to afford healthcare. And that's going to be their next emphasis is on healthcare. But you guys can read this, but basically what happened is that this woman who works for a nonprofit, she has a family plan and an individual plan that was afforded to her by the nonprofit. But the family could not cover the whole family, so she could only do it for herself. Her husband had type 2 diabetes. He developed an infection in the bone of his great toe, and he went to Heart of the Rockies because that's our county hospital. And the charge that she was given, first of all, they would not give her a charge or a bill at the time that they presented for the surgery. And when they found out what it was going to be, the charge just for the outpatient surgery center was $15,000, which in itself is just way, way, way higher than the charges in other Colorado hospitals and national facilities that she and I reviewed. The highest cost that we found was $5,000. And they charged her $15,000. They charged this family $15,000. Unfortunately, he got a postoperative infection and he had to have a second surgery, which was another $15,000, plus the fact that he had to be hospitalized this time for IV antibiotics. So their total bill came to $40,000, which is what is called charge master and upcharging. And that is what this hospital transparency movement throughout the country and in Colorado is all about. So we're not going to have time for me to go all of this stuff because I think it's so important that I get your guys' ideas. So I'm going to kind of go through some of the issues that we found when we did our research about hospital charges in Colorado. It's quite impressive. So this was commissioned by the Department of Healthcare Policy and Financing. It was done with hospitals that were greater than 25 beds. And it basically compared Colorado's hospital charges to charges throughout the United States and other states. And basically, it found that Colorado hospital prices were we ranked the 6th highest in the nation. And the price per patient is a lot more, which is important when you look at healthcare expenditures for the state of Colorado. And so I'm just going to flip to the next one. We were the 2nd in the nation in profit per patient. And basically that profit per patient was a little bit under $3,000 per hospitalization. It's 3 times higher than the national average of $963. This is why the legislature and the Department of Healthcare Finance and Policy is looking at hospital costs in Colorado, because it basically is 50% of the Colorado Medicare expenditures per year. So the other thing that's interesting is that most of the hospitals in Colorado, 90%, are classified as nonprofit. That doesn't mean that they make they don't have a lot more money coming in than what they are expending. What it does mean is that they're supposed to put that back into other services, and they can't take it as a profit that's distributed to shareholders and so on and so forth. But it doesn't mean that these hospitals are not generating a lot more income than what their expenditures are. And that's what this 176-page report showed. But remember, it's hospitals that are 25 beds or higher. Heart of the Rockies is 25 beds. The Heart of the Rockies and rural hospitals were not part of this. One of the things that was mentioned in this report is that rural hospitals have to be looked at a little bit differently than the larger metropolitan areas, because they are such an integral part of healthcare delivery, and there's usually just one of them in the county where there's a lot of rural type of where there's not a lot of citizens in that particular county.
Carol, are we a nonprofit?
We're a nonprofit. Yeah. But that doesn't mean that we don't make a profit. So
I know.
I have a slide on that.
Another thing, and maybe you have this on here, but as members of Chaffee County and some of Swatch, we pay taxes for Heart of the Rockies. I mean, they are a taxing. We get part of our property tax.
Part of their revenue comes from our tax.
For them, but
Yep,
it's something.
yep.
So they are
Absolutely.
We get to vote on boards.
So this one is very important. So remember, we're 90% nonprofit, and that most of these hospital systems that's not these rural hospitals, what they do is that they take in the revenue, and then what they do is they do capital improvements or capital assets, meaning that there's mergers, acquisitions, new buildings, And what it does is that it takes what could be saved for patients, puts them into new buildings, puts them into hospital mergers and acquisitions, which decreases the market competition and keeps Colorado's hospital costs, as I said, sixth in the nation, second in the nation for profit. Okay. And remember, 40% of hospital annual state budget, 40% of the hospital, 40% of the budget of Colorado is spent in healthcare. And if we could cut that down or make it so that we spend a whole lot less on healthcare, then we would be able to do a lot more things in regard to teacher salaries, basic infrastructure and yada, yada. You guys all know that. And 50% are going to hospital charges. And this report is the thing that has generated a lot of the legislative bills on trying to keep healthcare costs down, and also has generated a lot in what the Department of Healthcare Financing and Healthcare Financing and Policy, because Medicaid is a huge part of this budget, and they're trying to keep hospital costs down for Medicaid patients. Does it all make sense? Okay. So I'm just gonna, so a lot of the things that people have said, well, if you keep the hospital compensation down, then how are they going to pay for the indigent patient? The patient that comes in has a huge charge. And in the past, this has all been what is referred to as cost shifting. So one of the best examples of cost shifting that happened in the 80s was that you would come into the hospital, you'd have a panel of laboratory work done, and they would charge exorbitant prices for that laboratory work because it was compensating for another part of the hospital that was losing money. Does that make sense to you guys? That got stopped, but that's just a form of cost shifting. And this is something that the hospitals have used over and over again, and why they have to keep their charges so high. And there's a report that was done by Lieutenant Governor Primaveras that really totally dissed the whole idea of cost shifting. So I'm not going to go into that very much. Let's see here. So the key findings of all these reports is that hospital care is much more expensive in Colorado. Hospital profits have increased more than 280% from 2009 to 2018. Hospital prices went up more sharply than any other area of healthcare costs, and that uncompensated care levels for hospitals in Colorado are at historic low levels. And the cost shifts are driven by strategic decisions, not shortfalls from insurance for people who don't have insurance. So this is really important for all of us to understand that these reports have been done in Colorado. This is where we're at. This is what we know. And so now the legislature and the government is going forward on this. And that's why I think we have to find out from the Heart of the Rockies why their charge masters are so high.
Carol,
And that's
that third point you talked about, uncompensated care levels, what does that mean?
Oh, it means that when you go into the hospital and you have absolutely no money, that is an uncompensated care level. So if somebody comes into the hospital with no money, without insurance, and you have like a traumatic brain injury, or you have an orthopedic driven car accident, or you have a baby that's born who goes into the newborn intensive care, those are high cost things. They could go easily $250,000 to $1 million in hospital charges, and that is considered uncompensated care. Everybody has insurance, Margie. And in Colorado, because all of the things that they did to try to help the hospitals, including and especially the rural hospitals, those are at historic lows right now. That makes sense?
Okay.
That doesn't include Medicaid, is that correct? Because
No,
Medicaid is some compensation.
Medicaid is compensation, but remember, it's public financed compensation, Karen. It's not private insurance. It's public financed. It's through our taxes
Right.
and through the federal government taxes. It's not.
Carol, I have a question.
Mhm.
You have mentioned earlier that the data that you have given us is about the biggest hospitals, not about our little one.
That's right.
We can't apply this information directly to Heart of the Rockies.
That's right. And that's one of the problems with this report, is that it doesn't have the rural hospitals, which have sort of been codified into a separate area because everyone is concerned that we don't want these rural hospitals to fail.
Yeah,
So you
I
can't get any
understand.
data
I
on
just
these?
want to be perfectly clear in my mind. When we talk about these numbers, we're talking about the state level, not our county level.
That's correct. But we're talking about also that the transparency things are going to be, these rural hospitals are going to have to comply with these transparencies because a lot of these rural hospitals have a fairly significant profit margin, even though they're nonprofit. And that includes the Heart of the Rockies.
I agree, Carol. I just want to make sure that if we're going to use specific data, we've got to have the data for our hospital.
I totally agree. And that's what we have been trying to figure out how we're going to get. So no, I went from the very get-go. Heart of the Rockies was not part of this larger study, but I think my hunch is that Heart of the Rockies is very similar to these larger hospitals. And I'll show you why in a bit.
I have no argument with that.
Okay. So this was in the this is on the website of the Heart of the Rockies. This was their audit of their finances for, I think, 2020, 2021. Let's see. Yeah, this is the audit review of the Heart of the Rockies.
And you know, they're in
So
County and part of how far south do they go? They go into they go into Saguache, and aren't they down by Westcliff also, maybe? They
what
are
is?
a couple other little counties, part of counties. I know that there's a Heart of the Rockies clinic in Saguache, so
Do they do Western Fremont? Do those people pay taxes here?
I don't know.
I
Anyway,
think Westcliff was involved in them also. I think they have a clinic there.
okay. Sorry.
So basically, the operating income after revenues and expenses in 2018 was a little more than $8 million. In 2020, when the pandemic was in full force, it was 2 million. And in 2021, the operating income was almost $10 million. That operating income basically means that is what they have as discretionary funds to finance other things within the hospital. Could be, capital improvements. It could be whatever. And we don't know where they're using this money. And that's one of the things that we wanted to find out from the board.
My question is why they started a new pharmacy there, and within 2 years, they had to redo and spend $1 million to redo the pharmacy to bring it up to code.
Yeah. Okay, that's a good question. So basically, this is where their total operating expenses are. Salaries and benefits, as you would expect, are the largest one. Purchase services and so on and so forth. Supplies is another higher expense. But this is what their audit showed, and this is what I was able to find. Okay, so now we're going to talk about hospital transparency. Donald Trump in 2021 signed an executive order stating that hospitals had to be transparent with their charge masters and what people would expect to pay for services from those hospitals. So do you guys know what charge masters are?
No,
Okay, charge
No.
masters are arbitrary charges that the hospitals have come up with for every service that they provide. So IV services, X-ray services, Tylenol tablets, those are all on the list called a charge master. And the hospitals notoriously have been able to charge whatever they want for as long as they want. And what Trump's executive order stated was that that was no longer going to be the standard operating procedure. Hospitals had to provide on a website that was available to the public what their charges were for anything that was happening in the hospital. And then he left office, and then President Biden signed his own executive order, which is now in effect. And hospital transparency is one of the things that the Colorado legislature has passed also. So basically, what this means is that if you are not compliant with having a website that has what your hospital charges are, then you will be found to be non-compliant, and you will have a very small penalty of $300 a day after a complaint has been filed. And basically, the hospitals have not been compliant with this because $300 a day for them is peanuts. So they have found, CMS has found that hospitals are very much not compliant.
did they have a certain time that they had to comply? Or I mean, it started January 1st, or they had 6 months, or what was the time?
No, it started right after Trump signed the executive order. So that was basically 2019.
For
Yeah.
several years, okay.
So basically, then the public health department through CMS started actually promulgating regulations, as government does. And so gross charge hospital, these are these charge masters. They needed to also tell us as individuals what the discounted cash price was going to be, and if there was going to be a discounted cash price. So when you go back to my friend, when they were charged $15,000, that was an arbitrary charge that the hospital put into place that they had no ability to negotiate with. I don't think we went into it, but at one point, this family was told that they really should get a divorce so that he could go under Medicaid. That is what the financial advisor of the Heart of the Rockies told this family when they were trying to negotiate down the price. They finally got the price negotiated down, but not anything close to the $12,000, which other entities would have charged. So basically, CMS came through with regulations, and again, the hospitals have not been very compliant. So I'm going to go. And as you would imagine, the American Hospital Association was not pleased with this executive order, and they fought it. They were not able to overturn it. So now the Colorado legislature in 2022 promulgated a law. It was House Bill 1285. And basically, Governor Polis signed it into law June the 8th of 2022. And what this does is that it prohibits hospitals for initiating and pursuing collection against patients or their guarantees for debts incurred. So it doesn't necessarily make the hospital more transparent, but what it does is that it gives these patients who have no insurance or are underinsured, it gives them some muscle in order to go to do a legal action against the hospital if they have not been forthcoming with trying to work with him with the debt that they have incurred because of the charge master charges that they were incurring because they had no insurance. So to make this a little bit clearer, we as a Medicare patient, CMS has negotiated with each hospital a bundle charge for a hospital diagnosis. So if you and I go into the hospital with pneumonia, CMS will pay the hospital a fixed amount, no matter how long you're there, and no matter how long how great the complications are. So if you go in for pneumococcal pneumonia, you get a certain amount of money from CMS, and the hospital has a huge incentive to get you out of the hospital as soon as possible so that they can keep that bundled cost, they can keep below what the hospital is going to be expending for that charge. Does that make sense to you guys?
Yeah, what does CMS stand for again?
It's Center for Medicare and Medicaid Services.
Okay, thank you.
Because don't a lot of these charges, aren't they based on the Medicare, what Medicare allows?
Absolutely. That's what these are. That's that bundle price. So that's for a
Okay.
Medicare patient. So if you go in as a 36-year-old and you've got Blue Cross Blue Shield and you go in for pneumococcal pneumonia, Blue Cross Blue Shield has done the same thing with the hospitals. They have negotiated a price for that diagnosis and for that hospital stay. Okay, what happens when you go in as a 45-year-old or 50-year-old patient with pneumococcal pneumonia and you have no insurance? The hospital can charge you whatever they want, and that is what the charge masters are all about. And that is what the Colorado House bill and the executive order is trying to stop, these high charge masters, because nobody knows where they come from, and you can't, in due faith, negotiate with people. So that is one of the things that is trying to be changed in hospital systems.
Carol, for clarification, is the charge master an actual person at the hospital who makes the decision on what that procedure should receive monetarily?
Yes.
And
There's
they
a
just do
person,
that on their own, or is that just a,
it's done through the hospital administration, but it is done in an arbitrary way, not based on what the hospital's costs are. It's based on what the hospital thinks it can. It's Karen, it has its origin in cost shifting.
right? Yeah,
Okay.
I mean, I literally keep an Excel spreadsheet of every bill that I get from
Mhm.
Medicare, and I could never figure out, they're charging $300 for this physical therapy appointment. Medicare approves 200, but the supplier only gets, $25 or something like that. It can be that egregious, and it makes no sense.
Well, in reality, Medicare pays part of that bill, and then your supplemental pays
Right.
part of that.
Right.
But that charge was negotiated, Karen. If you have somebody who goes in without any negotiation, the hospital can charge you whatever they want. And that's where that $15,000 outpatient surgery suite charge came from. Versus if you went to a freestanding surgery suite, we found prices from $3,500 to $5,000. Does that make sense?
Yeah. Thank you very
Okay.
much for doing this.
I know this is real complicated, but, and we all kind of go, oh God, it's over our head. We don't want to deal with this, but I think we got to start dealing with this because we're not even coming close to having a system that works for people. Okay.
Carol, I also would like to sum up because I worked at CU Health Sciences Center for a decade, and it's illogical and absurd to me, the people that do not believe in single payer systems, because logically you would think someone without insurance would pay less as a cash patient than the negotiated prices of
Mhm.
insurance companies. But because insurance companies are strong arms, they negotiate, as Karen just described, these absurdly low reimbursements to the hospital, and then the cash pay is gouged or screwed, you know. So I think one thing that is incumbent on all of us is that we do learn to talk about this on a conversational level, that hospitals will charge you for your water bottle $76. Well, they're buying hundreds of thousands of them, and the water bottle truthfully maybe costs $2.
Yeah, yeah. I mean,
But
and
that's
that
what
is
the
certainly,
charge master is.
that's what the charge master is. Yeah. So you can, I mean, you can be charged that, but you're not going to be reimbursed. So charges and reimbursement pretty much have become less and less directly involved. So the hospitals can pretty much charge whatever, and if they can get that, fine. But if you have no insurance, it means that most people don't have insurance because they can't afford it. There are some people who just say there's a percentage of our population that refuses to have healthcare insurance. They're just going to take their chances. But that is a very, very small number. Most people who do not have insurance is because they simply cannot afford to pay for it.
Well, and we
The
also,
comments that Wendy made, she said that that the people who don't have insurance should actually be paying less than the people who have insurance. And I agree with this, but I also think that when you look back and see the millions of dollars profit a year, the insurance companies aren't getting that big a deal.
you know, and Carol, just quickly before Eileen's comment, all of us know that what Cigna negotiates versus what Anthem Blue Cross negotiates can be totally different. So our healthcare system is a hot mess. It's chaotic and it's unfair. And we really need to get to a system where the insurance companies and the hospitals are not making enormous profits. And meanwhile, people who desperately need health care cannot get it.
And that is one of the League of Women Voters' very strong emphasis on equity and access. So to sum up what we found with all of our reading and so on and so forth is that we really need to find out what's going on in Chaffee County. And we wanted to talk to the hospital, and we're going to brainstorm some areas that we can talk to the hospital. We wanted to find out with Chaffee Cares what their kind of experience is with people in producing these videos for healthcare. Jody put together a really interesting putting a face on healthcare in Chaffee County. And basically what it is asking people what their experiences are. So I have a thought as I'm sitting here, you know, with this presentation. Margie, what would you think of us writing a very short survey of what the League of Women Voters experience has been with healthcare in Chaffee County, just to kind of figure out what our own league's experiences are. If we could work through the leadership team and get that out with people, I think that would be informative.
Are you saying to publish that?
Members here and talk about our own membership experiences and find that out. Is that what you're suggesting?
Our own membership experiences.
I think that could be something, Karen.
But to put that out to the public?
No, to
Yeah.
our league members.
Just a member to start with.
Okay. right.
Are you also thinking that, I'm thinking a panel, maybe at our November meeting, that maybe somebody from the hospital, somebody from Colorado or Chaffee Cares or Public Health, I mean, having a panel and start talking about some of these issues and having those people come, and that we can talk with some of these issues brought up, but start feeling and getting more information, and then maybe they would then be willing to be a part of a panel rather than one-on-one. I don't know. What does anybody else think that would be worth trying?
Well, not only that, but I guess I'd like to know what the state, have you talked with the state? What initiatives are they looking at from a state level? Because there's more power at the state maybe
Well,
to
she's
do
given it.
controlling down than there might be for us to go up, because I do agree with Wendy. This is a much bigger problem than just Chaffee County. And when they did that survey, if my memory corrects me, of hospitals, St. Anthony's, which is Centura, as far as I know, was at the top of the scale for the abuse of pricing. So we might be better off. Have you done anything with the state's healthcare policy? What are they doing, and is it related to what you'd like to do here in Chaffee?
Oh, no, we have very much partnered with the Department of Healthcare Policy and Financing. We have attended their webinars. We're on their emailing list. There's a big, huge initiative for Medicaid charges in hospitals, and it's called the Hospital Transformation Program. And that Hospital Transformation Program, it's had its initial application submission in April and July of 2021. And now they are a year into this, and they are looking at, as I said, Chaffee, Heart of the Rockies is part of this hospital transformation program. That's why this discounted thing that Margie just got when she went into the hospital for an outpatient procedure. She got her Bill of Rights, which basically said if you were in 250% of the poverty level, you have a right for discounted services, whichever hospital you go into. So we have very much been partnering and finding out what the government entities are doing, and the government is really very much focused on trying to keep healthcare costs down for Colorado. I'm very impressed with what they're trying to do, but they're doing it through Medicaid. It has nothing to do with private insurance and so on and so forth. But at least those initiatives, as they are being placed on hospitals, are going to have, I think, a trickle down effect. But we have been attending the webinars.
And thank you for doing that. Wendy?
I feel like
It all goes back to whether hospitals should be profit or nonprofit. And what I've heard you say today is that majority of them in Colorado say they are. I don't believe them.
that's correct. And that's absolutely correct, Eileen. And Carol, I feel like I can really add here. I just have such limited time, but two things I want to mention. Number one, here in BV, we have the Valley-wide health clinic, and they have a dentist, a behavioral health, they have a doctor, a nurse, blah, blah, blah. And they are booked for months and months, but they are there for the people who do not have insurance. I do not know anything about their charges, but I absolutely believe that we need to get them involved in this conversation. Do you guys agree? They are booked out for months.
But they're not a hospital. They're a healthcare provider, and those are kind of two different things.
I understand what you're saying, but what we're talking about is the access to healthcare. And I will also mention, and if someone who can share their screen could pull this up right quick, I was involved with a group 4 or 5 years ago, Peak, PEAK, Peak Healthcare Alliance, wanted to come into Chaffee County as a nonprofit to provide an alternative to HRRMC. And there are a lot of people. Can someone pull up I have it. I just don't know if I can share. Let me see if I can share. Oh, I
I pick
can.
on my phone. I mean, I could call it up on my phone. Is Peak?
It's Peak Healthcare Alliance. So my reason for
That,
bringing,
but that's outpatient, Wendy. That's not hospital.
no, but we're talking about healthcare.
No, I'm just saying, but Peak is,
Hospital now.
yeah, Peak would not be competing with the hospital. They would be competing with the hospital outpatient ambulatory practices.
Yeah, and this group tried to pull in the hospital so that we could coordinate healthcare in Chaffee County in a broader sense, so that the exorbitant charges at the hospital and their walk-in clinics were not applying to all of our residents. And I will tell you, the hospital refused to participate. They said a flat no. And now Peak has had enormous success in Summit County.
Okay,
They are a nonprofit.
yeah, okay. All right, well, listen, I think we're
So
over.
Carol, can I say something?
Yeah,
This is Jeannie, Carol, and
uh-huh,
Wendy has a point. It's just that you're looking from healthcare at one angle. She's looking at healthcare from a different angle. And in a way, I have to agree a little bit with Wendy. People have a responsibility to have good health. And a lot of the people who end up in the hospital have not done anything and not access preventative care. So there's a bunch of issues here,
oh, there's, you
we
know,
need that. And that's a big issue all on its own. But what she's saying is if you can get them into a provider and maybe get them treated early, then of course you don't have them in the hospital. But you guys are, I think, coming from two different angles, which makes it hard. So, and I don't think it fits obviously with your goal. So you might want to reiterate your goal as your group.
so our goal right now is to try to interact and find out find data on what the Heart of the Rockies Regional Medical Center is actually doing. That's number one. Number two is to find out the state of insurance or insured people and where people are getting their health care in Chaffee County. That's just data collection that we're trying to do. And then the third one is partnering with Chaffee Cares to try to, get people's stories about what their experience with healthcare in Chaffee County are. So those are our three main areas right now
So I
that
just
we've
want to
identified.
say,
So
Did you-
on your third,
if you're evaluating where are people getting their care, you have to include Valley-wide in that discussion.
Yeah, no, I agree, Wendy. I totally agree.
They will give you data and I will
Mm.
help. They're very nice. I will
Mhm.
help.
So that would be added more information, yeah. I see the total healthcare, but I think going back to points 3 and 4 to get informed not only about the hospital, but I think just rural healthcare in general, that kind of takes in what Jeannie was saying, what Wendy was saying, that, where can people get healthcare and what that involves. I don't know, I'm not that familiar, I'm on Medicare, so I, just do my,
Yeah, in reality, most of us in the League of Women Voters,
are.
we're out of touch with this.
Yeah.
We've got a system.
Yeah.
However, if you really want to get scary, there's a lot of people that feel that Medicare funding is going to be absolutely gone in 2023. We don't have enough money in the bank to support Medicare as a healthcare entity.
The health insurance committee in the school district you know, and how frustrating that was to having, you know, insurance companies coming in and trying, and they, you know, they would never give you the same plan. We couldn't compare them. This one offered this, that one offered that. And it was always, you know, low, we were always getting low bids anyway on what kind of coverage. So that would be something else that could cover what kind of coverage do the people at the hospital working there, what kind of coverage do school personnel, the prison, they probably have fairly decent coverage there with their state employees. I mean, I don't know. Are there people working there that are falling through the cracks? So I think it would be good to learn all about what's available. Because, you know, in the 50 years I've lived here, we had one doctor when I moved to town and one hospital. And now we have, I don't know how many doctors, and we still have one hospital, but we have a lot more care available than we had. And the population, you know, has grown some, but it seems like we have a lot more in the healthcare than we did before. So I think there's money to be made somewhere, but I'd like more about that. So anybody else have any other comments or anything else they'd like to add or?
Carol, I just sent you a bunch of contact information for former
I just got it. Thanks.
board. So Margie, do you know if Tom Massey still lives in the area, or Eileen, do you know?
I don't know.
Because he was, I believe, after he was a rep, he went to work for the state health policy group
Right.
for the governor's office.
And that's been 10 years ago. So
I know,
yeah,
I know.
Yeah, you might know.
Okay.
some.
Thank you so much, Carol, for all the work you've done
Yeah.
on that. It was excellent.
So I think let's look at maybe doing some kind of a panel in November. Maybe we want to have Valley-wide come and talk. Maybe we want to have, you know, just learn about some of the other care, what's available in the county. And then from there, we can go on to something else. I mean, you know, go in further. That would help give us some information. Have the hospital talk, the Valley-wide, who else is there? This Chaffee Cares. I mean, you know, we can figure out, Carol, we can work together with that. But maybe have a panel of those people talking about what's available in Chaffee County and kind of just as an introduction, part of the 101 learning about healthcare in the county. And I like the idea of you sending a survey out, but like I said, most of the people in our membership probably have you know, are not on
Well,
private.
most people have Medicare, but and just talking with my friends, trying to get into a doctor in Chaffee County has become more and more problematic.
Because they're not open for more clients, customers.
Well, I mean, one of my friends just had an acute dermatology problem. She was able to get in on an emergency basis, but the follow-up is going to be in January of next year.
So
So, I mean, you know,
I think
and I want to talk to the people that did this healthcare assessment for Chaffee County is, I don't know, I'm trying to make rhyme reason of it. I really would like to talk to Andrea with the public health department and partner with them. We really have to partner with them in trying to find out a lot about this. And that's something that is on our list of to-do things.
okay. And if anybody else wants to join with your committee, please let Carol know.
Yeah, if anybody wants to join, I'm gonna get the contact the people that Karen have identified, but
Okay,
so I think my plea is that I don't think we can, I think we cannot be side standers any longer. I think we really have to get more involved in educating ourselves on healthcare because as a country, we are expending 18% of our gross national product to healthcare, and the majority of that goes to profit. And it drains everything out of the other things that we so acutely need as a country.
well, I
So,
like Wendy.
Okay, I gotta run. So thank you,
Thank you,
ladies.
Carol.
Thank you.
Thank you, Carol.